Ladies, if you're over 70, you've probably been told time and time again to stay on top of your checkups. But what if I told you some of the most common tests could actually put you at more risk than skipping them? I'm Dr. Elaine Foster, and in this video, I'm revealing 5 medical checkups that may be doing more harm than good for senior women, especially if you're not being fully informed about the side effects and consequences. Backhand index pointing right. So before you head to your next appointment, watch this entire video. It might just save you unnecessary stress, expense, or even a serious complication. And while you're here, don't forget to subscribe, give this a thumbs up, and comment below. I want the full truth if you're tired of medical half-truths. Let's get started. 1. Routine mammograms after 75. The hidden risks no one warns you about. You've probably been told since your 40s that mammograms are essential, and for many women, they are. But once you cross that 75-year milestone, the story changes and nobody seems to mention it. Let me be clear, early detection can save lives. But when you're over 70, particularly 75 and beyond, we start entering a gray area where the risks of screening can begin to outweigh the benefits. Here's why. As we age, the body's natural healing slows down. This means if something like a slow-growing lump is discovered, it may be completely harmless for the remainder of your life. Yet once it's found, we almost always feel compelled to do something about it, often resulting in a cascade of interventions that may not be necessary at all. Let's say you get a false positive, which becomes more likely with age because of tissue changes and benign calcifications. Suddenly you're called back for additional mammograms, ultrasounds, maybe even a biopsy. That biopsy might reveal a tiny, slow-moving ductal carcinoma in situ cysts, something that may never have become life-threatening. But once it's labeled, you might be pressured into a lumpectomy, radiation, or even hormone therapy. And here's the scary part. These treatments come with real side effects: fatigue, lymphedema, hormonal shifts, bone loss. And for many older women, the emotional toll of a cancer diagnosis, even a low-risk one, is crushing. Plus, each mammogram involves radiation, albeit in small amounts. But after decades of annual tests, those doses accumulate. And while 1 or 2 extra scans may not matter, over time, it raises the question, is this test doing more good or more harm? The American Cancer Society even states that screening decisions after 75 should be based on life expectancy and overall health, not habit. If you're otherwise healthy and expected to live another 10+ years, it may make sense. But for many women in their late 70s and 80s, the mammogram may uncover a problem that doesn't need fixing. And the fix can do more harm than the problem. Always ask your doctor, backhand index pointing right, if this mammogram finds something small, will it change how we manage it? If not, it may be time to rethink the routine. 2. Colonoscopies over 75, when the screening becomes the bigger risk. Colonoscopies are one of the most important tools for detecting colon cancer early, especially between ages 50 and 70. But what many older patients don't realize is that after age 75, the scale tips, and the risks from the procedure itself may outweigh the benefits of screening. Let's break this down. First, the bowel preparation process. It might seem like a simple inconvenience, but for senior women, drinking those harsh prep solutions can cause real problems. The aggressive flushing of fluids often leads to dehydration, electrolyte imbalances, and in some cases, acute kidney injury. I've even seen elderly patients hospitalized from the prep alone. Not to mention, it can worsen existing heart or kidney issues and cause dizziness that leads to falls, a far more immediate and serious danger for many older women than colon cancer itself. Then, there's the sedation risk. Your liver and kidneys don't process drugs the same way in your 70s and 80s as they did in your 50s. Sedation that was once light might now lead to delirium, prolonged drowsiness, or impaired thinking for days. And for women with any degree of cognitive decline or frailty, this can trigger a steep decline in overall function. Let's not forget the rare, but real danger of intestinal perforation. The older the tissue, the more fragile it becomes. One wrong move with the scope, and you could end up with a tear in your colon, something that would require emergency surgery and possibly result in a life-threatening infection. Now here's something most women don't know. If you've had multiple clear colonoscopies, no family history of colorectal cancer, and no significant digestive symptoms, your personal risk of developing aggressive colon cancer at this age is already very low. And even if something is found, many colon cancers in older adults progress so slowly that they wouldn't become life-threatening during your lifetime. There are non-invasive alternatives, too, like the FIT test or Cologuard, which use stool samples to detect possible signs of cancer without the ordeal of sedation and scope insertion. So before booking your next colonoscopy, just because it's been 10 years, ask yourself, backhand index pointing right, will the procedure help me live longer or just expose me to more risk? 3. Bone density scans. Are they leading to unnecessary and dangerous drugs? Now, let's talk about something almost every woman over 65 hears from her doctor. You should get a bone density scan. And yes, these scans, called DEXA scans, can be helpful in diagnosing osteoporosis. But here's where things go off track. Too often, these tests lead to overdiagnosis and overmedication, especially in women in their late 70s or 80s. Let's say your skin shows osteopenia, a term for mild bone loss that isn't quite osteoporosis. Many doctors will treat this as a red flag and rush to prescribe bisphosphonates like Fosamax or Reclast. The problem? These medications are powerful and come with serious side effects, including jaw osteonecrosis, a horrifying condition where the jawbone starts to die, atypical femur fractures. Imagine your leg breaking with no warning just from standing. Esophageal irritation, heartburn, and gastrointestinal upset, which are very common. Joint and muscle pain that can become chronic. And many of these drugs stay in your system for years. So even if you stop taking them, the risks don't immediately disappear. What's worse is that bone density alone doesn't determine your actual risk of fractures. More important is your balance, your muscle strength, your vision, and whether your home has hazards like loose rugs or poor lighting. But unfortunately, those factors aren't always discussed because it's easier to write a script than to recommend fall prevention exercises or nutritional guidance. For many senior women, especially those who are mobile, active, and have no history of fractures, the better path may be weight-bearing exercise like walking or gentle resistance training, calcium-rich foods like leafy greens and dairy, adequate vitamin D, ideally from sunlight, and regular movement to stimulate bone remodeling before you accept a long-term medication that could cause irreversible effects. Ask your doctor, backhand index pointing right, am I truly at high risk of a dangerous fracture? Or are there safer ways to protect my bones? For frequent CT scans and follow-up imaging, are you being exposed to unnecessary radiation? Let's talk about a trend I've been seeing more and more in older women, frequent follow-up scans. You go in for a simple checkup, maybe mention some mild chest discomfort, or a past scan found a tiny nodule. Your doctor says, let's be safe and order another CT scan. At first, it sounds reasonable. Better safe than sorry, right? But here's what no one explains. CT scans expose you to a high dose of radiation, especially when they're done repeatedly. Just one CT scan of the chest is equivalent to 100 to 200 chest x-rays. Now, imagine having 2 or 3 a year because your doctor keeps wanting to monitor something. Over time, that exposure accumulates. And while radiation from one scan may not be dangerous, consistent, and unnecessary exposure can raise your lifetime risk of cancer, especially for older tissues. And that's not even the biggest problem. What I worry about more is the rise in incidental findings, tiny, harmless abnormalities that are picked up during these scans. In older adults, your body is filled with little nodules, scars, and changes from aging. Most of these are completely benign, but once they're seen on a scan, doctors feel compelled to investigate further. Suddenly, you're sent for more imaging, maybe a biopsy, even a surgery, all for something that never would have caused you harm. It becomes a cycle of medical anxiety and intervention, not care. Let's say you have a small lung nodule show up on a CT. That could be a harmless granuloma, a remnant from an infection decades ago. But now you're told to repeat scans every 3 to 6 months to keep an eye on it. And each time, there's fear, stress, more radiation, and the possibility of discovering something new to worry about. Here's what I tell my patients. If your doctor wants another scan, ask 3 questions. Backhand index pointing right. What are you looking for specifically? Backhand index pointing right. Will the result of this scan change your treatment plan? Backhand index pointing right. Is there a safer imaging option, like ultrasound or MRI? That doesn't involve radiation? You deserve more than vague explanations, like just to be safe. You deserve clarity and to not be exposed to medical harm in the name of caution. 5. Annual full blood panels, the hidden dangers of overdiagnosis in a senior's body. Now let's tackle something that sounds completely harmless, blood tests. After all, what could be wrong with a simple needle poke and a few tubes drawn? Here's the truth. Annual full panel blood work in healthy senior women often leads to overdiagnosis, unnecessary treatment, and a mountain of stress. As we age, our bodies naturally shift. Some lab values that would be concerning in a 30-year-old are often perfectly normal for a 75-year-old. But most blood tests don't interpret results based on age. They just show high, low, or abnormal. That means even small deviations can cause alarm, leading to a cascade of testing, medication, or referrals. Let me give you a few examples. A sodium level that's slightly low due to mild dehydration gets flagged. Next thing you know, you're put on fluid restrictions or a diuretic. A borderline thyroid level, you're placed on levothyroxine, which might worsen your heart rhythm or cause unwanted weight loss or anxiety. A mild elevation in liver enzymes. Now you're sent for an ultrasound, then a biopsy, only to be told it was likely due to a harmless supplement or a single glass of wine. I've seen women terrified by numbers that didn't mean anything. Women put on medications that caused more problems than they solved. And it all started with a routine blood test. Doctors often order these panels reflexively without truly considering your health history or current complaints. But in senior care, we should be moving toward targeted testing, only checking labs when there's a clear reason to do so. Otherwise, we risk treating numbers instead of treating people. Now, does this mean you should never get blood work? Of course not. But if you feel well, have no new symptoms, and no chronic condition requiring monitoring, you have the right to say, backhand index pointing right, let's skip the blood work this time, unless there's something specific you're concerned about. Because real care isn't about throwing a wide net and hoping to catch something. It's about precision, purpose, and protecting your peace of mind.